Are you interested in becoming a nurse? Are you wondering what type of careers there are in nursing? Do you wonder what you need to do to become a nurse or a nurse practitioner or nurse educator or a nurse researcher? Well, this video is for you. My name is Laura Murphy, and I am clinical faculty here at the University of Texas at Austin School of Nursing. During this video, we will navigate through the different pathways that you can follow to become a nurse. First, we'll go over the basics of how to become a nurse and some of the different types of nurses. Then, our faculty members here from the School of Nursing who have specialized in various advanced practice roles and different careers in nursing will talk to you about what they do with their degree and how you can achieve that type of degree. There are many different types of nurses. There are licensed vocational nurses, or LVNs, who work as part of the nursing team in many long-term care facilities, clinics, and in some parts of the country, they can work in hospitals as well. LVNs often work under a registered nurse or a physician and can provide basic nursing care. Education that's required to become an LVN is usually a one-year program, but this may vary depending on where you go. You can also choose to become a registered nurse or RN. Registered nurses can be employed in many different places, but if you've been to a hospital, it's likely that you've seen a registered nurse in action. Registered nurses are trained to provide care, administer medications, perform nursing procedures, evaluate the results of those nursing procedures, provide education to patients and their families, and communicate with other members of the healthcare team, like doctors, pharmacists, and social workers. We're going to talk more about the education for becoming a registered nurse in just a second. You can become an RN after attending an associate's degree program, or what we call an ADN program, and that's usually through a community college or other program. You can also become a registered nurse by earning your BSN or bachelor's degree in nursing from a university or college. ADN programs typically take around 2 years to earn, and bachelor's degree programs generally take 4 years to earn. With an associate's degree, you will have an associate's degree in nursing, and with a bachelor's degree, you will earn a Bachelor of Science in nursing. To become an advanced practice nurse, like a nurse practitioner or a nurse midwife, you will need to earn your bachelor's degree in nursing and then enter into a master's program in nursing. Sometimes you can also earn a DNP, but we'll talk a little more about that later. Master's programs for advanced practice usually take around 2 years or sometimes a little more, depending on the type of specialty that you go into. These types of programs exist at most universities, but you'll want to do your research to determine which university has the type of program that you want to become. Some advanced practice roles include becoming a family nurse practitioner, a pediatric nurse practitioner, a nurse midwife, and many other types of programs. Some nurses wish to pursue further education after their bachelor degree in nursing, but don't want to become nurse practitioners. This includes things like becoming a nurse educator or specializing in a particular area like public health, administration, or really many other things. These nurses will pursue their master's degree in nursing, again at the university level, and programs generally last for about 1.5 to 2 years or so. If you want to become a nurse researcher, the PhD, or Doctor of Philosophy degree is right for you. You will need to earn your BSN, then your MSN, and then enter into a PhD program. I know, that's a lot of school. Some universities have faster paced programs where you can start with your BSN and end with your PhD in a much shorter time than if you did the degrees separately. So you'll want to look into that if you know this is the route you want to go. With a PhD, you can do research in nursing to really help to improve nursing as a profession and all of healthcare. You can also teach new nurses, such as here at University of Texas at Austin. Earning the PhD takes generally around 4 years or more, and many different universities offer this type of program. Other nurses, especially nurse practitioners, may want to work and practice at the highest level of the healthcare system as leaders. And so the Doctor of Nursing Practice degree, or what we call the DNP, may be the way to go. For this degree, you will need to have your BSN and then obtain your master's and enter a DNP program. Like the PhD program, some schools have faster paced programs to earn your DNP. So you'll want to check into the different programs that are offered depending on what type of nurse practitioner or advanced practice nurse you want to be. Nurses with a DNP, in addition to becoming leaders in the field, can also teach at schools of nursing. To earn a DNP, it usually takes between 2 to 3 years, and again, many different universities offer this program. Wow, that's a lot to know, I know. But now that you've heard some of the basics, I'm going to go ahead and turn it over to our faculty here at UT School of Nursing so they can talk to you about their particular specialty.
Hello, I am Dr. Abyad, a women's health nurse practitioner. A women's health nurse practitioner is a registered nurse with a master's degree specialized in caring for women of all ages. Most often we work in a primary care setting, such as a clinic or a private practice. Sometimes we work in a hospital, for example, on a maternity unit triaging patients. We offer many services, annual physical exams or exams and treatment for special problems such as sexually transmitted infections. We provide contraceptive counseling and insertion of devices such as IUDs or hormonal implants or fittings for diaphragms or cervical caps. We also care for women before, during, and after pregnancy. We order lab tests, prescribe medications, and treat common problems. We treat uncomplicated problems and refer women to physicians for more serious complications. The bulk of our care centers around health promotion and health maintenance, which means we do a lot of teaching and counseling about how to stay well.
Hello, I'm Dr. Amanda Simonton. I'm a clinical assistant professor at UT Austin School of Nursing. I'm a psychiatric mental health nurse practitioner with a PhD. To become a psychiatric nurse practitioner, one must first complete a bachelor's degree and then go on to either a master's program or a Doctor of Nursing Practice program. As a psychiatric nurse practitioner, I assess, diagnose, and treat individuals with psychiatric issues such as depression or anxiety. I prescribe medications and use therapy techniques to help my patients feel mentally and emotionally better. I can see patients who are children or adolescents all the way through older adults. Psychiatric nurse practitioners work in outpatient settings, hospitals, correctional facilities, and really anywhere that there are medical professionals. It's an incredibly rewarding job, and I would encourage anybody to consider it for their future career.
Hi, I'm Adam Blank, and I'm an acute care nurse who works in the hospital setting. The patients I care for require hospitalization for a variety of health issues, including heart attacks, strokes, pneumonia, problems with their muscles or bones, surgeries, or cancer. The care I provide includes closely monitoring patients for changes in their status, administering medications, and educating the patients about their health conditions and their overall health maintenance. On a typical day, I'll care for 3 to 5 patients, and we'll develop a care plan in close collaboration with the patient and their families, as well as the whole spectrum of other healthcare providers. The goal of that planning is to help the patients recover from their immediate health issues and to transition back to their home environments safely and healthily. Well, for the most part, my nurse colleagues will have a bachelor's degree in nursing, but many have associate's degrees and some of them have master's degrees. Acute care nursing is a fast-paced, challenging career, but it's extremely rewarding to have the opportunity to help members of my community overcome their immediate health challenges, which oftentimes are life-threatening, and to assist them in enjoying the highest quality of life possible when they leave the hospital. Thank you.
Hi, I'm Dr. Julie Zuniga, an assistant professor at the School of Nursing. I'm here to talk about public health nurses. Public health nurses promote and prevent health diseases for an entire population. They do advocacy, education, activism, assessment, and evaluation of public health. They are involved in the prevention of disease while promoting public safety and well-being. They educate the public health issues and provide support to other medical professionals. Duties for the public health nurse include assessing health trends to identify health risk factors specific to specific communities. They assign priorities for health-related interventions in order to provide the greatest benefit. They advocate at local, state, and federal levels to improve the access to health services in underserved populations. They design and implement health education campaigns and activities for disease prevention. They also provide information for health programs, services that are available to improve access to health care. Some public health nurses provide direct healthcare services to at-risk and vulnerable populations, such as tuberculosis monitoring and assessment and treatment. For education, public health nurses often have a bachelor's in nursing. Others have specific training with a master's in public health nursing, which provides further education on policy, epidemiology, health promotion, illness prevention, and much more. There are also nurses with their PhD whose research focuses on public health. Public health nurses work in government agencies such as the Department of Health and Human Services. They work for nonprofit groups, health community centers, and any organization that aims to improve health at the community level. They also work in academic settings teaching public health and in researching public health. Thank you, and I encourage you to become a public health nurse.
Hi, everyone. My name is Dr. Chris Diven. I'm a family nurse practitioner, and I teach in our family nurse practitioner program at the School of Nursing at UT. And I've been a nurse practitioner since 1997. It's an incredible profession. You get your master's in nursing, become a family nurse practitioner. You have an opportunity to care for patients throughout the lifespan, tiny little ones, pregnant women. We do a lot of health promotion, health maintenance. We do a lot of chronic disease management and care for people throughout their entire lifespan. Nurse practitioners can work in lots of different places. Our training is in primary care, and a lot of that emphasis is on keeping people well, health prevention, disease prevention, health promotion. And it's nurse practitioners work in primary care clinics. Some nurse practitioners specialize. I've worked in a primary care clinic caring for people throughout the lifespan. I've worked at domestic violence shelter as a primary care provider for children and adults affected by domestic violence. I've worked in geriatrics. Some nurse practitioners do specialty work in congestive heart failure clinics. But basically, we value that trusting relationship that you establish with patients and try to keep people healthy throughout the lifespan. It's a great profession.
Hello, my name is Dr. Stephanie Key, and I am a pediatric nurse practitioner. I am the director of the primary care pediatric nurse practitioner here at UT Austin. We also have an acute care program for pediatric nurse practitioners. If you are interested in becoming a pediatric nurse practitioner, you should first get a few years of experience as a pediatric nurse. It doesn't have to be in the hospital setting. It could be in a clinic setting or home health. We just ask that you have a desire to take care of children. In the acute care program, they do require that you have some acute care experience. While you're in school, you will learn more about diagnosis and management. You will take advanced courses in pathophysiology, pharmacology, and advanced health assessment. In primary care, we teach you how to conduct well-child exams, to learn about growth and development, to be able to order vaccines and provide anticipatory guidance to both patients and family. You are also trained to conduct a thorough history and physical exam when a child is sick, create a differential diagnosis, make a diagnosis, and create a management plan. As an acute care nurse practitioner, your training is geared toward the severely sick patient who may be in the ER, who may be hospitalized in the pediatric ICU. So the scope of practice of an acute care nurse practitioner is geared toward the more severely acute sick patient. Our program is a master's program, but our programs will turn into doctoral programs in the next several years. If you have any questions about becoming a pediatric nurse practitioner, feel free to reach out to us. Our program has been going since the mid-90s. We have a 100% pass rate on certification exams, and we look forward to meeting you.
Hi, I'm Dr. Teresa Bailey, one of the nursing faculty here at the University of Texas at Austin School of Nursing, and I am also a neonatal nurse practitioner. Now, that started when I became a nurse after earning my Bachelor of Science degree in nursing, which we have here at the University of Texas at Austin, and started working in the Neonatal Intensive Care Unit, or NICU, taking care of NICU infants. And I became an advanced practice registered nurse later, which you can do with either a master's or a doctorate degree, again available here at the University of Texas at Austin. And what I do is manage care of those infants now in the NICU setting, and that's premature, ill, and even well newborns in the newborn nursery. And all of that starts here at the University of Texas at Austin.
Hello everyone, my name is Dr. Sharon Carter, and I'm a nurse. Even though I'm a nurse, I'm called a doctor because I hold a doctorate degree, specifically a Doctor of Nursing Practice degree. And I have the wonderful opportunity to help take care of patients when they're in the critical care units, specifically the ICU or intensive care unit. I get to help the patients when they are at their most vulnerable and ill and just simply can't take care of themselves anymore. But I get to do something even more wonderful than that. I get to help other people realize their dreams of becoming a nurse by being a nursing educator. I use my doctorate degree to help other people make their dreams a reality of becoming nurses and leaders in healthcare and help transforming patients' lives each and every day.
As you can see, there are many different things that you can do within nursing. Hopefully, the presentation you've heard today has helped you figure out a little bit more of where you might want to fall into our great profession of nursing. If you have any questions, you are always welcome to reach out to us here at the UT School of Nursing. Good luck and hook 'em.